I began working with the Congress in about 2002 and came on to the Congress of Health and Safety as a consultant, primarily in industrial hygiene. And our first project together was looking at a hospital in the Boston area that was using ultraviolet radiation to bathe the surgical suites because they thought it was going to help with their infection rates on their surgeries. We performed measurements and interviews and site observations and found that the nurses and the surgeons in the operating suite were being overexposed with ultraviolet radiation, and they were getting sunburns, which is a carcinogen. And the hospital was really unaware of those conditions, and we looked into it, and over the period of, it took about 4 years with the National Institute of Occupational Safety and Health involved, we finally persuaded the hospital to stop using this form of what they thought was infection control, and to work to solve a problem and protect the nurses.
And that they actually exceeded or did what you asked them to.
Yes, yes. Took 4 or 5 years, but they finally did it.
And what other kind of work have you done with the Congress?
We looked at nursing exposure to hazardous drugs in the workplace. Again, the National Institute of Occupational Safety and Health had done a survey, and they realized that healthcare workers were being exposed to hazardous drugs in the workplace. And it's not just chemotherapy. It's all across the healthcare system. And we did a survey of MNA nurses to see how many of their hospitals and their associations and their clinics were actually practicing the preventative actions that NIOSH had recommended in 2004. And the results of our study indicated that the controls and the protections that had been recommended were misunderstood and not being implemented. So we have further projects now to work with nurses and practitioners to improve their safety controls.
And how much, what has it meant to be working with the Congress in terms of addressing these issues, to be working with staff nurses who are there every day?
The work that I've been involved with has been the most fulfilling and rewarding in my career, to be able to work with nurses and bring what I know to them, but also I've gained so much out of that experience that I then take back to my profession, industrial hygiene. So I've presented the results of our findings and our studies at health and safety conferences and industrial hygiene association meetings, which is really breaking it out of nursing into many other areas that can help solve problems.
And how much of, how do I want to say this? How much of this do you think would have happened had it not been for the Congress and for having Evie here and having, you know, the kind of organization that the MNA has set up?
The MNA and the Congress of Health and Safety, and Evie Bane in particular, have been a leader in workplace health and occupational health, particularly for nurses and in healthcare. And we've oftentimes been the innovator, been the cutting edge, been the ones pushing the envelope that force an issue to be looked at more closely. We just found out this week that our work in hazardous drug assessment has led to some of the area hospitals to pick up the ball and do their own studies on hazardous drug exposure and get federal funding and do research in those areas. So, and we feel like we were the ones that pushed that issue along in the beginning.
And looking over the last 10, 12 years that the Congress has been in effect, can you talk a little bit about, I know this is somewhat repetitive, but talk a little bit about the role of this committee in terms of nursing and healthcare inside of, I mean, health and safety inside of hospitals.
The fact that we have a committee, the Congress on Health and Safety, to address local issues as they arise, and then to put the energy and the emphasis and bring professionals together to try and solve those specific problems that occur here in New England in large urban hospitals or even in rural hospitals in the Boston area, puts those issues on the forefront, and oftentimes we're doing that ahead of any other hospital system or nursing system in the country. You know, there's really a handful of places that in the country that operate like this, getting the real issues to the board, pulling people together and looking to solve problems.
That was perfect. If you can, tell me a little bit about the methodology of the Congress in terms of working with outside folks. You know, working with NIOSH or working with MASCOSH or, you know, working with the Department of Health and, you know, Public Health and that's working with outside experts, I guess.
The Congress on Health and Safety really bends over backwards to bring people from other areas of expertise into that group. So it's really a group of nurses with years of experience in nursing and some interest in occupational health and safety and the workplace safety, but the ability to bring in other universities, fund consultants to come in and help with support that group in certain areas, work with other organizations like MASCOSH or NIOSH, or even have a relationship with OSHA on an ongoing basis, has really been a backbone to the Congress.
How have you seen, or have you been able to be, by working as a consultant with the organization and kind of coming and going, shall we say, you know, working on different projects with them, have you seen a development and a growth in the committee and the members of the committee?
I think that for the Congress, unfortunately, it's always an effort to keep that group together. Synergistic relationship, and you know, a group like that is always subject to the whims of the individuals that participate. It is open to any MNA member to come join that committee, and if there's an interest in worker health and safety, occupational health and safety, I would encourage anybody to get involved. It's rewarding, you learn a lot, it's very fulfilling. You know, whether it adds to your resume or not, it adds to your character and your career in a way that other things really couldn't.
Okay, and now, as we were saying the other night, the most important question, is there anything that you think that would be good to include that we haven't covered?
I like to say that Evie Bane has really been a leader and a mentor and a really good friend of mine and a motivational force for the Congress. I hope that as Evie retires and she finds great happiness with looking back on her career, that the Congress can survive, find new leadership that can motivate another group of people to come in and continue both the research, the cutting-edge innovation, the thought-provoking analysis of conditions and hazards in the workplace, and move the Congress on for the next decade.